I'm Dr. David Barber, and I work with the center in the realm of the CPCSSN Project. CPCSSN is the name of our pan-Canadian project, and CPCSSN stands for the Canadian Primary Care Sentinel Surveillance Network. And this is really a network of networks. We have sites across Canada, and each site is working with physicians who have EMRs. And what we're doing is we're taking data from EMRs at each of these sites and aggregating the data from across Canada into a central repository which is actually held here at Queen's. And this allows us to study this data. Currently we're focusing on 5 chronic diseases. That's really our focus at this stage. In order to study those 5 diseases, we're pulling a lot more data from the different EMRs. So as it stands, right across Canada, all of our networks are pooling the data, and we have different research studies that are going on. Locally, we're recruiting more Sentinel physicians, and that's our priority at this point in time. And then, of course, analyzing the data and making sure that the data that we're pulling is actually accurate and valid. So we've been doing chart audits along with this. Our plans with this data, of course, relate to surveillance, but also allows us to do other studies. One of our focuses for the next while is going to be looking at the issue of data discipline, and data discipline is really the realm of making sure that the data that we're entering into electronic medical records is actually the right data and going into the right place. And when we pull data from different EMRs across the country and locally, sometimes the data isn't as high quality as we want. So we're looking at ways to make sure that we're getting the right data, but also to maybe give feedback to the Sentinels and how they can improve data collection. One of the studies we're doing here locally is looking at tools that we've used to try and improve the data we're collecting around the smoking habits of our patients. And this tool was implemented back in September, and we're going to be following data along for the next little while to see if we're actually getting better data quality. Beyond this, I mean, really, there's a wide area of research that can be done, and we're going to be looking at taking advantage of this resource so that we can ultimately provide better patient care to really everybody across Canada. This is a very exciting project. It's not one that really exists at this level in other countries across the world. So we're really leading the pack, and we hope that we're going to have some exciting projects that come from this. I think that's about it.